Thank you,
Yes.
Dr. Sonu.
Yes, so I think I'll invite Miss Opinderpreet Kaur Gill. She is Director Programs in Generation Saviour Association and founder of another organization that is Girls Rise for Mohali. She has an ample experience not only in tobacco control, but also in various public health activities. And she has been working in trans fat for quite some time. And she will share some experience of working with the trans fat with us. Over to Upinder. Yeah.
Thank you, sir. Can we please move on to the next slide? Yeah, next slide, please. So in the previous presentations, we've heard all the technical aspects of industrially produced trans fats. Now we're well equipped by the dangers of trans fat that it has on our health, on our cardiovascular health. And also, Dr. Om has very nicely summed up the global good practices around eliminating industrially produced trans fats. So in my presentation in the coming next 5 or 7 minutes, I would like to sum up the spade work that has been done in the state of Punjab for taking up this initiative of eliminating industrially produced trans fats from our food chains. So just a brief about what our organization is. So it is a non-profit organization, and we've been working in the field of public health since 1996. And the main aim that we work with is to constantly work for preserving the health of present and the future generations. At GSA, we believe that together we can not only bring policy initiatives, but also work towards a behavior change so that our nation emerges as a healthier country. So we've heard in the previous presentations that how, if we are talking about eliminating industrially produced trans fats from our food chains, how policy and behavior change go hand in hand. So Dr. Poonam ma'am has very clearly explained what exactly trans fats is, what is the scientific model and the built-up of trans fats, and then what foods, which are the regular foods that we are taking in our daily routine that has such high content of trans fats. Dr. Om has spoken about policies. Dr. Sonu has spoken about how we can incorporate various departments and various stakeholders in the country to actually bring up about the change of this unhealthy food options that we all are opting for. Next slide. So as I mentioned, that we've been working in the field of public health. So when we talk about nutrition and health, the initiative that we started with was on child obesity, and we used to have some school intervention programs and community level activities where we touched both the aspects of healthy eating, the nutrition part, and also the importance of physical activeness. As it is very rightly said, you are what you eat. And also when we talk about our health, it is 70% of what we eat and 30% of the physical activeness that we are into in our daily routine. And nowadays, as we all know that the physical activeness levels are going down because of our, the job profiles that we all are into. We are more into sitting jobs. With the advancement of technology, our mechanical works have become very easier. So the diet is even more important now than it was ever before. Next, please. So just to comprehend, the seed project that we had from GHAI, which is now partnering with PGI to eliminate industrially produced trans fats in the state of Punjab. So under that project, the activities that GSA in partnership with GHAI took was at 3 levels: the state level, district level, and supporting the community level initiatives. So I'll be speaking a little about the journey that it has been so far in the last 12 months. Next, please. Next, please. So the first thing that even I think, can we go to the previous slide? Yeah. So every speaker spoke about the data that we need to have to actually advocate for stronger policies. And as Dr. Om also said that, there is very less data around how bad trans fats are, what is the presence of trans fats, and especially in the raw material that is going out to all these FBOs, the food businesses. So we started with actually mapping on the manufacturers that are there in the state, the ones that are manufacturing the hydrogenated vegetable oils. And we came up, we squeezed down to 5 industries that are presently operational in the state, which are producing these HVOs. Then also we mapped the operational status of the NABL accredited labs for testing of oils and fats. Again, this point was very rightly pointed out by Dr. Om into the challenges that we really lack facilities and the abilities to test the oils, the foods, the raw material that is going into the daily working of our FBOs. And also the mapping of key stakeholders to identify and create a circle of influence. So this is in addition to what Dr. Sonu said, that it is not just the work of one particular department or one particular organization, but it is we as together into the society, some people from different departments, policymakers, and the community people at large. Can we go to the next slide? So when we spoke about the capacity building activities that we carried out in the last 12 months, the first experience that we had when we moved out into districts and state levels was exactly what Dr. Om and Dr. Sonu has spoken about, that people were not very aware of, how trans fats are so dangerous to our health, because there is very less evidence and very less studies out there in the public domain. So it became very necessary to, to sensitize people sitting at the state levels, the policymakers, and to get the elimination of trans fat into the mainstream priority areas of public health. So that was the spade work that we did through capacity building meetings. Those was one-to-one meetings, and also some, capacity building workshops in good times when we all were able to meet in person and discuss about things. Can we go to the next slide? So as I think Dr. Om, or maybe I forgot who mentioned about the activities that have been taken up under this program by PGI. So they organized a camp in the media houses. So I think media plays a very important role whenever we talk about some policy level changes and also behavior changes. And we also started in the same way by organizing a media advocacy workshop in which more than 60 journalists participated, and also a series of, a series of print media stories followed that. Next, please. Next, please. So I'll just take you through the activities on a pictorial form only, because a lot of technical things have already been discussed. So yes, there is a need of very strong multi-sectoral setup that needs to work towards coming up with a roadmap, coming up with an action plan, and also drafting and coming up with stronger policies to curb the industrially produced trans fats at the supply level also. So in respect to that only, the first level of a multi-stakeholder consultation was organized early last year. And in this, people from various departments, the Food and Safety Department, FDA, Health Department, civil society organizations, food nutritionists, biotechnologists, so all of them were present in this consultation. Next, please. Also, we were able to create a consortium. So this consortium actually works under our organization, in which we have civil society organizations working in the region, that is for the state of Punjab, Haryana, and UT Chandigarh, working on different NCDs, and we tried to get those people together for our purpose of amplifying the need of eliminating industrially produced trans fats. And if PGI and Cypher would want, we can use this platform again to actually create that influence, that public influence that we need for advocacy of stronger policies. Next, please. And also, we have been able to come up with a fact sheet around trans fats. What are the health impacts? What are the existing policies, and what are the scopes in other existing laws that we can incorporate and start with some groundwork of actually getting the food safety department and the health department together and working towards sensitizing of the FBOs, and also making them accountable of what they are serving to their people, or to their customers. So this is again just a little glimpse of what the state level workshops included and what the district level workshops included. So one very positive outcome that came out of the district level workshop especially was that in every district that we went to organize these capacity building workshops, we had the FBOs of that district attending those workshops. So one of the speakers spoke about this also, that we need to make aware the vendor of the raw materials that he or she is consuming while producing the goods for sale that is available in his or her business, and also kind to motivate them in telling them that if you're going to serve healthier options, they could be a little overpriced, and it's not going to be something that's going to hamper your business. So these policies are not there to hamper your business, but it's going to be of benefit to you also, because you'll be providing healthier and better choices for your customers. And we had a very good and a positive response from all the FBOs. Many districts, if you'll go and visit Hoshiarpur, Patiala, Fatehgarh Sahib, and the FBOs have those pledge that went from the health department, from the food safety department and the health department to the FBOs, pasted on their in their hotels or their chains, maybe the sweet shops, bakeries, and all those. So they have those pledges pasted right there at the premises. Next. So we saw a very good, even commitment from the departments, the food safety department under the able guidance and leadership of Mr. K.S. Panu, the Commissioner FDA. So we all know that desi ghee is something which is which is very important when we talk about the state of Punjab, and we also know the adulteration that is going into those oils. So the desi ghee that we buy out from the market, it's not the pure desi ghee that we usually buy. There's a lot of adulteration of vegetable oils into those desi ghees and artificial fats. So there was a DO letter issued by the government of Punjab in which they banned, any ghee that had anything other than the milk fats into it. So no artificial fats were allowed to be mixed with the desi ghee. So they banned all those. And even when Dr. Sonu mentioned about the ice creams, so when we read all these labels, many of you might have noticed that the ice creams, usually there's just one or two brands that write the word ice cream on their packets. Usually it is called frozen desserts. And that is because they don't have any milk product into the ingredients. If you'll turn around and read the ingredients in there, but they say vegetable oil. So it is all artificial fat that is going into our ice creams, and it is not the milk ice creams that we are eating. So there's just leaving just one or two brands of ice creams. All others just have vegetable oil in it. And Mr. Panu had also issued a letter. They've written to the center wherein he is demanded to get those addition of vegetable oil into the milk desserts also banned, into the frozen desserts. Can we go to the next slide? So yeah, these are the few glimpses of the district level activities that we conducted. So in the period of 12 months, we've been able to sensitize more than 300 participants from different departments. And when we talk about the community level activities mixed with the one-to-one meetings with the stakeholders, we've been able to touch more than 1,000 stakeholders, which can be very useful when we speak about eliminating industry produced trans fats. Next slide. I think I've already spoken about it, so I will not go through it. Next slide. Again, when we talk about community level change, when we talk about behavior change, the most important segment that our organization has always thought of is the children, because it is better, the younger they are, the better it is to get them into a habit of choosing healthier foods, healthier lifestyles, and making them aware of what they're eating. Because most of these products that are out there in the market, they are marketed to the youth, because even these industries know that, it is the right age to catch them young, to make their lifestyle choices, to set up their mind to one direction. So I think moving forward, the civil society organizations that are watching this webinar, the other partners with PGI, I think we really need to lay a lot of emphasis on the education system, on the, on children of schools and colleges and universities, to, to make them equipped with the right knowledge so that they make the right choices. And when we have the demand for healthier choices, the advocacy for stronger policies on healthier choices being available is a little easier task to do. Next slide. So yeah, these are just few of the community level activities that we organized, and they were all in partnership with the health department. So some the hypertension checkup and the awareness camps, cycle rallies to promote physical activity on the World Heart Day, and a lot of other such activities were being organized. Next, please. Social media, again, it plays a very important role. We get, and especially in times like this now, where all our information that we are getting is through the virtual platforms. So physical campaigns and physical activities have been limited, and there's a lot of scope into the virtual world now to create that awareness, which is again very cost effective, and also with comparatively less effort, we can reach out to many number of people. Like, take example of this webinar. So if we have to organize a webinar, a capacity building session for 100 or 200 people who are watching this webinar now, it would have been such an expensive affair. But in this one, in the last 2 hours, we've been able to, disseminate this knowledge, disseminate this information to such a huge number of participants watching this webinar, and this resource is going to stay on the channel and people are going to benefit from it. So social media in today's time play a very important role. The virtual world has gone even bigger, so we really need to make a lot of use of that as well. Can you go to the next slide, please? So challenges, yes, I think Dr. Om has very nicely summarized all these challenges. So I will really not spend much time, and I will just go through it and discuss a little about what we as an organization experienced in these last 12 months. So the priority of the food department has till date been more on adulteration rather than the inputs that go into the food. So when we talk about trans fats, it is again, we need to bring that issue of eliminating industrially produced trans fat into the priority list of the food department, the food safety department. Influential industrialists. So yeah, whenever we are fighting in industry, it does pose a threat. But I think for this initiative, even the food safety, the FSSAI has also partnered with a lot of industries, wherein they have asked them to be the champions of providing healthier options. So that was also one way of doing it. But again, we'll have to stay, we'll have to stay very alert of how the industry responds to the policy, to the policy recommendations that we as civil society organization, or we as research organizations, offer to the government. And yes, the most important area that need to be worked upon, I think that is countrywide, is lack of testing facilities. Because till the time we don't have that testing facilities in the state under the government setup, the enforcement of the policy, because we already have a policy wherein the component, the percentage of trans fat is limited to 5% in all oils and fats. But the testing, the enforcement becomes a challenge when we don't have testing facilities equipped within the states, within the districts. So that is something that we really need to work on. We really need to advocate for, and get the departments moving on to with that. Next, please. So the way ahead, I think, very nicely said by all the speakers. We really need to create vast level of awareness on the ill effects of consumption of industrially produced trans fats. Any person normally, till the time they don't have the knowledge about trans fat, the only content we see when we look at the label is how much fats are in there. And And majority of us don't even know how to read those labels, because that is just on a particular serving that they have mentioned those labels. So yeah, we need to create a lot of awareness, and a lot of effort is going to get into it to get people to change their habits of getting foods only which have labels onto it, not buying from loose vendors, and all those things need to get onto it. Sensitizing the media, as I said, that without media we really cannot bring about that change that we all desire for. um, Again, the second the thing that we, again, this was the suggestion that we got from the people working in the government setup, wherein they said that if we have portable TPC devices, it's going to become very easier for us to actually go out and check the input material, that raw material that is coming into the FPOs. So yeah, these things should also be advocated to the department, so that we have a proper mechanism, a proper setup of enforcement of getting the data and collecting the data. So again, and civil society organizations creating that multi-stakeholder engagement is very important for any public health issue. So I think that is the end of my presentation. Can we go to the next slide? Yeah. So we pledge to collaborate, cooperate, and commit to build a healthier today and